Hi, my name is Dr. Susie Lachowski-Glass, and I'm very excited to provide a brief presentation on how KAATSU training can be applied in the sports medicine and exercise professional world. I want to specifically thank KAATSU Global for inviting me to present at the Paris 2024 Olympics. Let's dive in. A brief presentation overview includes a welcome from myself. I'm going to then describe what KAATSU training is in the most general terms for the exercise science or sports medicine professional. And then I'm going to provide why KAATSU training is beneficial to incorporate into your practice. I'm going to give over a brief snapshot to some of the performance and health results that we are seeing with KAATSU training. And then I'm going to provide just 3 ways you can implement KAATSU training into your practice immediately. So to get started, my name is Dr. Susie Lachowski-Glass. I am the Executive Director and Associate Professor for the Division of Health and Human Performance at American International College, as well as am a core faculty member of the Division of Physical Therapy. And I also own Glass Training and Education, and that's where I provide a lot of comprehensive education on the blood flow modification modality. I have a comprehensive education regarding, some people know it as BFR, but we also talk about KAATSU and everything and what all the differences that may lie in between the modalities as well. And lastly, I am a KAATSU training specialist, as well as a blood flow modification, hemodynamic alteration training expert within the field, where I again provide comprehensive education to professionals, but also train individual athletes and general population in the blood flow modification modalities to enhance overall performance and health and wellness benefits. Thank you for having me, and I'm excited to continue on with the presentation. Okay, so next I'm just going to summarize what KAATSU training is. There's a lot more to it than what I'm just about to state, but for the purpose of this brief presentation, I'm going to give some key points. So KAATSU training, KAATSU in Japanese means additional pressure. And what we're going to be doing is modifying blood flow patterns. I usually like to call it hemodynamic alteration training. But what we're going to be doing is using these specialized elastic pneumatic bands, and we're going to be placing them on 2 places of the body, which are the upper extremities and the lower extremities. You're also going to place it as proximal as you can on the upper thigh, as well as on the upper arm, right below that deltoid insertion, as well as below that gluteal fold on the upper thigh there. We are going to be adding various amounts of pressures into the band and out of the band to manipulate blood flow. And by doing so, we're going to see a lot of local and systemic physiological responses that are a huge benefit to us. Some of which include increase in neuromuscular fiber recruitment of our large muscle fiber types, going through anaerobic glycolysis quickly. We're building up metabolic waste, which then can activate a neural hormonal cascade of releasing growth hormone, which then in turn will release IGF-1 downstream, which then indirectly can help build and repair tissues as well as heal the body. There are also a multitude of aerobic benefits to this type of training. So we are manipulating, again, blood flow patterns. But with KAATSU, we are allowing arterial blood flow into the muscles and into the muscle bellies, but we are manipulating venous outflow. So we're increasing venous compliance, but we're also increasing the blood pooling within the venous system and increasing the amount of metabolites that could be potentially building up, and therefore creating a number of local and systemic effects here. But next, I'm going to show you exactly how to just place the KAATSU band on an individual so you could potentially do this in practice as a sports medicine or exercise science professional. And then I'm going to dive into how this could be beneficial in your practice and to get your athletes, your clients, or your patients healthier, stronger, or performance-wise to the next level. Here's a quick example of how to apply the KAATSU band system onto an individual. You're going to place the band proximal up on the extremity and make sure it's just as tight enough to get 1 finger's worth underneath the band. Have the individual plug in the system and then set it to whatever program they're going to be using for their exercise session that day. So here are some key reasons why you should incorporate KAATSU training into your practice, whether you are a physical therapist, athletic trainer, strength and conditioning professional, exercise science professional. Here are just some of the decades worth of research benefits and physiological outcomes that have been shown to occur with KAATSU training. We have seen an increase in muscular strength, increase in muscular hypertrophy, reduced muscular atrophy, enhanced resting and fat metabolism, increased muscular endurance. We've seen a reduction in pain, improvement in quality of life, improvement in power output, increased protein synthesis, improved cardiovascular fitness variables, which include diminished resting heart rate and resting blood pressure, diminished muscle damage, as well as enhanced neuromuscular recruitment and potential to improve bone density. So there are a number of reasons to start incorporating KAATSU into your practice, and these are just a few of them that have been, again, researched for decades. So next, we're going to pop into 3 ways you as the exercise science professional or sports medicine professional could incorporate this into practice, and how I like to do so as well. So here are just some 3 key ways we can incorporate KAATSU training into practice. We can apply it into the rehabilitation world and the post-surgical world. What I like to call strength and performance therapy. I like to call it bridging the gap, and I'm going to get into that in just a little bit. And then also we could use KAATSU training for specifically performance and recovery. So these are 3 very different sections of training. You can apply KAATSU where you can see a multitude of those benefits that I just discussed, right? So the first one we're going to discuss is how you could use it or incorporate it into rehabilitation or with your post-surgical patients. The example I'm about to give is going to be post-surgical, but also explain a little bit of some of the patients or clients I have either collaborated with or worked with where KAATSU is actually shown to be very beneficial in this area. Okay, so the first example I'm going to give you is that you could use KAATSU training in a post-surgical or a passive application sense. You can utilize KAATSU cycles specifically to do this and add in neuromuscular electrical stimulation. You can do it with or without an MES. However, we found it to be a great benefit to be able to, if you're able to activate muscle fibers without compromising joint angle or the surgical site, in addition to KAATSU, to help preserve muscle mass, mitigate disuse atrophy, as well as enhance performance later on. So what happens here is that we have used KAATSU cycles with, again, NMES in post-surgical patients or individuals who can't change their joint angle as much. So here, some of the benefits are they do not compromise surgical site or joint limitations that some have post-surgery. So let's just use either an ACL surgery or some sort of surgery right afterwards that we can't completely manipulate the knee joint right afterwards. We can activate these muscles involuntarily with the E-STIM unit. In addition to the KAATSU, with the benefit of the alteration of blood flow patterns, we could start mitigating the disuse atrophy that is going to come along with a post-surgical situation. So next is a video example of how you can apply a KAATSU band system in addition to an E-STIM unit in order to provide these benefits. Here you can see we have applied the E-STIM unit to the individual, which then will involuntarily contract the quadricep muscles in addition to doing KAATSU cycles. So the purpose of this is to not compromise the joint angle or the potential surgical site, but also to activate the muscle fibers while manipulating blood flow patterns. And by doing so, we can mitigate disuse atrophy as well as enhance neuromuscular recruitment. By preserving more of their muscle mass, we could potentially get this athlete back to performing sport-specific movements even faster. Okay, so another area where I like to explain to professionals where KAATSU could be of a great benefit would be during what I like to call a strength or performance therapy phase. This is where we're bridging the gap where an athlete is graduating from their physical therapy or rehabilitation program and then heading on to their traditional strength conditioning program again. They are cleared by the surgeon, they have graduated therapy, and they're ready to go back to play. However, working with a lot of athletes and speaking with a lot of physical therapists and working with a lot of strength and conditioning professionals, as well as myself working with a lot of athletes, there sometimes are still a lot of performance deficits that are occurring immediately post-rehab. Not all the time, but there's still a good chunk of athletes that have a lot of deficits and are not fully ready to go back to full competitive play. Sometimes once the surgeon clears the athlete to go back to play, all these deficits could actually still increase their risk of re-injury. So how can we narrow in on that gap where the individual could be back to play sooner and even potentially even better than they were before? KAATSU training is a great way you can apply sport-specific exercises in addition to manipulating blood flow patterns. So therefore, we can increase that neuromuscular recruitment, increase muscular hypertrophy, and also work on those other variables that may be in a deficit to them. So I had an athlete, I'm going to use an example of a D1 female soccer player where it was post-ACL rehabilitation, was cleared by the surgeon. Surgery went great. Rehabilitation went very well. However, if she were to be thrown right on the field immediately post-release, she would have not been successful, and she would have had an increased risk of re-injury. She had deficits in agility and reaction time. She still had, her quads were still atrophied. So what we did here is by utilizing hemodynamic alteration training or blood flow modification training, in addition to her sports performance training, we were able to catch her muscular tissue back up to where it needed to be. And it was actually even stronger than it was pre-injury, as well as work on her reaction time and agility and so forth. So this can actually narrow in on that gap from an individual being graduated from rehabilitation to getting back onto the field. So I like to call this, again, this area strength or performance therapy, where you're not in physical therapy anymore. However, you are also not completely ready to, say, get under the squat bar and lift as much weight as you were pre-injury, right? So we got to kind of narrow in on that gap. So this is a great way in order to do so. Here are some exercise examples of an individual who was released from their rehabilitation program, but not quite ready to go back to competitive play yet. We can utilize KAATSU in addition to sport-specific movements and traditional training in order for them to bridge that gap and enhance musculoskeletal benefits to get them back to their sport faster. Okay, so the last way I'm going to explain where sports medicine and exercise science professionals can apply KAATSU training is in performance and recovery. Let's talk about traditional athletes for a second. So some individuals have come up to me and say, oh, this type of training seems really good for the rehabilitation field or for just, health and longevity or the aging population, but does it have a place for traditional athletes who aren't injured or do not have some sort of performance deficit? And I said, absolutely. The way I like to perform KAATSU training with traditional athletes is as an icing on the cake situation or utilizing it during their active recovery days. This can enhance what they have done in their traditional training program by enhancing the recovery of the musculoskeletal tissue, as well as potentially giving that extra neural hormonal boost at the end of a traditional exercise regimen. So for example, what do I mean here? Let's say someone was engaging in a heavy lower extremity workout day. So we had heavy squats, some Bulgarian split squats, as well as lunges and all those other kind of good things, right? I would still train them in that traditional sense with a traditional heavy resistance overload. But then at the end of the session, apply KAATSU and either utilize KAATSU cycles or utilize KAATSU cycles in addition to some low body weight exercise where I'm not loading them or their tissues with heavy amounts of weights, but just using a metabolic buildup with repeated reps or higher amounts of reps in that set. So what this does is this activates an extra neurohormonal cascade. We'll get an extra boost of growth hormone and IGF-1 released down the line, which then over time, over the next couple of days, will then help build and repair that tissue. So it enhances recovery as well as this can aid in those performance benefits. So I think there's a way to utilize KAATSU in all walks of life or all forms of, doesn't matter where the athlete is in their training, whether it mean they're post-surgical, they're in that gap between that rehabilitation phase and heading back onto the sports performance phase. Or if they are in the sports performance phase, how can we augment what we're doing in a traditional sense? And this is the way I like to do it. So I hope I gave you 3 good ways that you could utilize KAATSU training as a sports medicine or exercise science professional. It's not just in one area or the other. You could actually use it in all different phases. So next, I'm just going to show you some video clips of how you can apply KAATSU training with traditional athletes or on their active recovery days. Here's where we can utilize KAATSU training with traditional athletes. Here we utilize low loads or low intensities in addition to KAATSU training at the end of their traditional exercise regimen or on their active recovery days. By using low loads, but also manipulating blood flow patterns with the KAATSU training system, we can activate those type 2B muscle fibers within the exercise task. However, when we do so, we are going through anaerobic glycolysis much quicker, and therefore we have more metabolic waste building up. That increase in metabolic waste buildup will then increase that neurohormonal cascade of that growth hormone release, and later on IGF-1 down the line. This can help enhance recovery and augment what you're doing in a traditional sense. Lastly, I like to utilize KAATSU on the active recovery days and have individuals walk on the treadmill for that extra musculoskeletal, but as well as cardiovascular fitness benefits. And with that last example, that concludes our brief presentation on how you could apply KAATSU training immediately into practice as a sports medicine or exercise science professional. I would love to talk to you more about these benefits and the physiology of this modality. So please feel free to get in contact with me at any point in time. And again, I just want to thank KAATSU Global for this invitation to present at the Paris 2024 Olympics. It's been a true honor. Best of luck to all of the athletes.